This is a story about a plastic surgeon who claimed to have invented what would have amounted to a miracle cure for a devastating skin condition. But in reality, the data behind it was allegedly fabricated, and infections on human trial subjects hidden. Dr. Aziz Ghahary, a UBC researcher, invented a liquid skin substitute called Meshfil. He said it could cure chronic pressure ulcer wounds, known more colloquially as bed sores. They can affect people who use wheelchairs, people with diabetes, and anyone who spends a lot of time in a hospital bed. And once you get one, they're really painful, very hard to treat, and can stay with you for years.
It would be close to miraculous, really. Pressure injuries have the biggest impact on quality of life of any of the complications common to people with spinal cord injuries.
Meshfil promised to cure years-old sores in just 2 weeks, but the research told a very different story. This document shows the University of British Columbia knew all of this, but never told the public about what happened, even after promoting the product themselves. We know this because CBC News and the Investigative Journalism Foundation obtained a copy of this document, a 64-page investigation into plastic surgeon Aziz Ghahary and his product, Meshfil. The investigation into the research was done by an outside panel of experts hired by UBC. It found these false claims gave patients and funders false hope by falsely claiming that Meshfil had quickly healed chronic pressure ulcer wounds. He also potentially endangered the health of future human trial subjects when Dr. Ghahary falsely claimed that there had been no adverse effects during the pilot study. The results of this investigation were never made known to the public until now. Ghahary quietly retired from his job at UBC shortly after the investigation was complete. He declined our request to sit down for an interview. His lawyer said this wasn't by choice, that he is legally bound by confidentiality obligations that prevent him from commenting on the matters you have raised, even to defend himself. That experts who reviewed the report for us said this kind of academic misconduct is serious.
The findings of the report are extremely serious. There are a lot of things that go on with this pilot study that simply shouldn't happen.
So what exactly went wrong with this study? The report points to a number of things. The team set out to find 12 spinal cord patients to test Meshfil. When they couldn't find patients that fit that profile, the study was expanded to patients suffering from surgery wounds. A nurse working on the study recorded official measurements to see if the wounds were shrinking. The UBC investigation found that Ghahary and his lab team recorded their own measurements of the patient's wounds, even visiting one of them at home. This went against the approved protocol. And the UBC report found there were, quote, significant discrepancies between Ghahary's lab team's data and the data recorded by the nurse.
The very basic point, there's not supposed to be two sets of data when a study like this is taking place. There's supposed to be one set of data. And it's data that Dr. Ghahary is not supposed to be playing a role in generating because of his financial conflict of interest.
In the end, Meshfil improved some of the surgical wounds, but none of the pressure ulcer wounds fully healed, and a handful showed signs of infection. The nurse told investigators, "I would never use it for chronic wound healing because of the infections she observed." But the report found that Ghahary continued to promote Meshfil as successful on YouTube, in a presentation to WorkSafe BC, and in applications to expand the study. In his defense, Ghahary said he didn't know not all patients in the study had pressure wounds, but the report found he would have had access to all patient medical records. His lawyer said in a statement, to portray an individual's entire legacy through the narrow lens of a single confidential event risks creating an inaccurate and damaging public narrative. They said Ghahary has nothing to hide in relation to his career as a scientist and is proud of his career achievements. UBC also declined to speak to us for this story, saying privacy law prevents UBC from commenting on allegations of scholarly integrity you've raised. But the ethics experts we spoke to said this should have been made public, especially since Meshfil was publicly promoted by the university.
And so I think when these investigative reports disappear from view, are never made public, there's an important educational opportunity that just never takes place. And of course, that's in some respects advantageous for the institution because they don't have to deal with very challenging questions that might be embarrassing, certainly don't fit a good PR storyline.
Many questions remain, including were the patients in the human trial ever informed about this investigation and its results? And when a university promotes a product later found to be the result of problematic research, what is their responsibility to the public? Michelle Ghoussoub, CBC News, Vancouver.